This is the capstone and 5-year plan by Christy Ford for nursing course 4580 at Lamar University with Dr. Troy Palmer. I am Christy Ford, ADN RN. My academic background is graduating with my LVN in 2004 from Lamar State College, Orange, and then graduating with my ADN in 2015 from Lamar State College, Orange as well. I am currently working in the emergency department at a local hospital and have been for the past 3 years. I am a member of the Emergency Nurses Association as well as the Nurse Peer Review Committee at the local hospital I work with and the Unit Practice Council. I hold certifications within the ACLS, ASLS, PALS, and trauma nursing course. Humanity and society. The learning objective number 1 practices safe and effective holistic patient-centered care to a variety of patients, clients in multiple settings from a global perspective by incorporating theories and evidence-based findings. This was within the nursing course 4620, Nursing Practice, Care of Patients with Compromised Multiple Health States. The assignments completed were the practicum reflections 1 through 4 and the CBSL activity. Within my assignments, I interviewed a middle-aged man who underwent a sudden cardiac arrest witnessed by a bystander who immediately started CPR. We developed a plan of care from evidence-based practice with measurable goals and interventions to help reach the goals, which included lab work every 3 months, increased activity, diet control, and ways to decrease stimuli that led to his anxious feelings. Within the CBSL assignment, I interviewed a 72-year-old man with a very low income who had an extensive cardiac history, along with a current tobacco and alcohol addiction. Within this activity, I researched free community resources that the patient could take advantage of, as well as provided means for him to contact the resources for help. This outcome achieved was 100%. Lifespan Health Continuum. For learning objective number 2 supports patients, clients in preventing disease, maintaining wellness, promoting and restoring health, and advocating for death with dignity. This was found within the nursing course 4316, Comprehensive Holistic Health Assessment, and the assignment completed was the Healthy People 2020, in which I identified the mental health and mental disorder goal as stated to improve mental health through prevention and by ensuring access to appropriate quality mental health services. I discussed how mental illness is affecting the city of Port Arthur, researched how to address mental health care in the emergency department setting, and proposed policies and procedures for a mental health emergency crisis department. This outcome, I feel, was achieved at 100%. For learning objective number 3, evaluates patient-centered care for patients, clients across the lifespan based on common and complex health needs and compromised multiple health states when considering multiple determinants of health. This was found within the nursing course 4620, Nursing Practice, Care of Patients with Compromised Multiple Health States. The assignment was the community-based service learning activity. Within this assignment, I interviewed the same 72-year-old man with a very low income and extensive cardiac history. I researched multiple health states that he had, which were pulmonary embolism, atrial fibrillation, venous insufficiency, chronic pneumonia, and COPD, along with researching free community resources that the patient could take advantage of to manage his chronic disease state. The outcome achieved for this course was 100%. Evidence-based practice and clinical reasoning. For learning objective number 4, synthesizes clinical reasoning and judgment in nursing practice, utilizing critical thinking, nursing process, research, and evidence-based practice. This was within the course of Nursing 4550, Nursing Practice, Leadership, and Management in the Healthcare System. The assignment completed was the practicum assignments and the clinical application. Within the practicum assignment, I identified a problem within my unit as it related to patient safety using the National Patient Safety Goals. I identified the problem as clinical alarm fatigue and how it relates to the care provided to the patients by the nurses, how the patient safety and treatment plans are affected by telemetry alarms, and what objectives the department could implement to allow for better patient safety and care. The outcome achieved 100%. Patient-client centered care. For Learning Objective 5, employ safe and effective patient-centered care using theories and evidence-based findings in collaboration with patients and clients and members of the interprofessional and interprofessional healthcare team. This was found in Nursing Course 4321, Nursing Theories and Online Education. The assignment was the research theorist and it was presented through the class discussions. I researched Mercer's Becoming a Mother theory in nursing practice, which suggests that there were different stages of becoming a mother: the pregnancy, the birth, and integration of maternal identity. I also researched James Prochaska, who proposed that humans find themselves in a cycle when it comes to change through the trans-theoretical model of behavioral change theory, making it reluctant for humans to forego any true change. The outcome for this learning objective achieved was 100%. Professional roles. For Learning Objective number 6, differentiates multiple role dimensions and practices within ethical and legal and regulatory parameters when caring for patients and clients as a member of the interprofessional and interprofessional healthcare team. This was found in Nursing Course 4390, Nursing Inquire Evidence-Based Practice. The assignments were the group discussions. For this course, we researched quantitative and qualitative research. We also, within the discussions, I researched ethical issues in nursing research and provided evidence-based research along with violations within the ethical principles and provided examples of the research project related to the discussions. For Learning Objective number 7, demonstrates professional integrity, effective communication, active inquiry, and service to the community. This was within the Nursing Course 4540, Nursing Practice Care of Communities. The assignments completed a practicum project along with the teaching plan and video project. Within this course, the assignments were to complete the practicum project complete a practicum project with a windshield survey of selected community aggregate. I interviewed several people within the community aggregate as well as interviewing people involved with that specified community. I researched disaster preparedness for hurricanes, which is the primary disaster within our region, as well as developed a teaching plan for disaster preparedness tailored towards that specified community. The outcome achieved for both of these learning objectives was 100%. 5-year plan. By 2019 spring, I would like to graduate from Lamar University from the BSN program. And in 2020, I would like to apply for the master's program for nurse practitioner. In 2021, I would either apply or already be working as a flight nurse to get the experience as a critical care nurse, as well as obtain my certified emergency nurse certification. In 2022, graduate from the master's program, and in 2023, test and obtain my licensure for the nurse practitioner. Thank you for taking a look at my project, and I look forward to the next 5 years.